I'm going to talk to you about how some of the most common medications for relieving joint pain can actually damage and destroy your joints. Now, joint pain, sore knees, sore hips, the most common cause of that is called osteoarthritis, and that's caused when the cartilage between the bones and the big joints breaks down. So imagine this piece of paper is a bit of cartilage, it's in your joint, providing a nice bit of cushioning like a shock absorber in a car, make your joint more comfortable. Well, as you get older, you produce less and less of the nutrients that make this cartilage, so it breaks down and you end up with bone on bone. Now that's obviously very painful when you get the bones rubbing together. What can be worse is if those bones, because of the pressure, start to get jagged, then you get jagged bone rubbing on jagged bone, and that's like having broken glass in your joints, and that's painful. Now, I don't need to tell you, but that can really impact on your quality of life. So you might not be able to go for walks with your friends or even get down and pat the cat. Getting upstairs can be a problem. If you love playing sports, then you know, the old golf course is out of bounds now. You can't enjoy that, or tennis or bowls. Whatever you like to do becomes more difficult. Even getting around and doing your housework can be more problematic. And so what that means is that you become dependent on others, and all because of the cartilage and your joints is wearing down. So a lot of people do turn to these painkillers to help them relieve the pain so they can function normally and do their normal activities. And the tragic thing is they just don't know that these medications are causing damage in the joints. But let me be quite clear, this is the real stinger. The non-steroidal anti-inflammatory painkillers that are freely available, your doctors prescribe them, they're available in the pharmacy over the counter, even in petrol stations and supermarkets, they have been proven to destroy cartilage. Okay, let me be perfectly clear about that. The anti-inflammatory pain relieving drugs have been proven to destroy cartilage. And that's a real problem, because they make it feel better, so you think you're doing a lot of good for your joints, but it's actually causing more pain. Think of a sports person with niggles and bumps throughout their career, taking anti-inflammatories over and over and over again. By the time they get to retirement in their 40s and 50s, their joints have had it. And people think it's just because they've used those joints a lot. It's not. It's often because they've used these painkillers. That's the real problem. Okay. Now, I know that by revealing this information, I'm going to come under a little bit of pressure from the pharmaceutical companies or other health practitioners. But look, it's just so important for me to tell you this information, to get the real truth out there and advise you about what you can do to fix this problem. So we know that osteoarthritis can really impair quality of life. We know the main painkillers can actually make it worse. So what can you do? You do need to relieve the pain, yes. But you also need to rebuild that cartilage. So the ideal treatment not only reduces that pain so you can do the things you love, but it puts that piece of cartilage back in your joints so you can be more active again. And that's what we've designed with our Osteoarthritis Optimal Health Solution. It's a solution that will rebuild cartilage and take away the pain. It contains a series of nutrients that have been proven to do just that, proven in clinical trials and in real life, in tens of thousands of patients, proven to be as effective as the anti-inflammatory drugs in relieving pain over a period of 2 weeks or more, proven to be safe. In fact, studies comparing it to the inactive ingredient placebo, they call it, no difference in side effects. So safe and effective, and it's your best chance of being pain-free in the long term. You can imagine, you know, if you take some pain today and you take a painkiller, it may work a little bit better today, but what you're thinking of is a long-term strategy so you can get back on the bowling green or on the golf course or wherever you want to be. Patting the cat again. Okay, so our optimal osteoarthritis health solution, you'll find one on the gondola close to the screen. We've produced this brochure which gives you some information, key information about the ingredients that are in there and why they are so important. These contain the nutrients that have been proven to be missing as you get older. As you get older, you have less ability to make these nutrients to make the joint cartilage, so we're putting back in all that fuel so your body can make its own cartilage and make its joints all comfortable and healthy again. Okay, so we know these things have got proven benefits and we know that they're safe. I know there's a lot of people that give you a whole lot of advice and information about what you can do to improve your health, and solutions here and solutions there and information on the internet. It can all be really, really bewildering. So what we've done here is we've used our clinical experience. I'm a pharmacist and I'm a nutrition medicine practitioner with over 20 years experience in tens of thousands of patients in my clinic and in my pharmacy, and I'm giving you the benefit of what are the key nutrients that are going to be both safe and effective. So all you need to do is grab a solution off the gondola and take control of your health. The sooner you act, the sooner you'll get the benefits. Do it now, or talk to one of our friendly staff if you want more information. Thanks for your time.